So
Trying to position my
welcome.
phone.
All right. So welcome everybody
Yeah.
to our Beauty Boss session from Absolute Joy. As many of you may be aware, we have been actually doing a series of conversations with other Black-owned, women-owned beauty businesses, primarily because, one, we're all inside, and so we want to find other opportunities to really support other businesses. But I think there's not only the effect from an economic perspective in terms of what's going on with COVID, but there's also the opportunity for us to not feel so isolated, as well as the opportunity for us to take a moment to care for one another. And so for those of you who are joining us on Instagram, we actually have on Facebook an Absolute Joy skincare group. And one of the things that we asked in the skincare group is, what are the big things that you want to talk about? And so right at the top of the list was people want to talk about just basics of skincare. And so we actually created the 7-day skincare challenge, which tells people about what it is that they need in order to really adopt a good skincare routine. But the number 2 issue was dark circles. And so while we are a physician-led skincare line, I think that the issue with dark circles is actually rarely, if ever, addressed just with products, and there's actually a lot of complexity behind it. So I wanted to make sure that we really heard from an expert. And so I had the opportunity to meet Dr. Simpson about 6 months ago at this point, when I had a pop-up store at the Brown Beauty Co-op here in Washington, D.C. And there was a very refined woman who came in and was asking me all these very tough questions about my brand. And I thought, she's either a doctor or a lawyer. So it turns out that she is a doctor, a dermatologist who is here in the Washington, D.C. area. So let me introduce Dr. Simpson. So as I mentioned, she is in private practice in Arlington, Virginia, and works on the basics of dermatology. So the things that we would expect in terms of skin cancer screening, acne, and psoriasis. But in addition, Dr. Simpson has a cosmetic dermatology practice that works on non-invasive cosmetic procedures such as lasers and fillers, Botox, cool sculpting, and other types of procedures. So for those of you who are not here in the Washington, D.C. Area, you can actually get to her office because she does virtual consultations through her practice. So if you're interested in asking any questions, you can go to alexandriaderm.com in order to make an appointment to participate in her virtual practice. Last week, we had a conversation with Dr. Nika, who as we started to talk about issues in terms of managing melanin-rich skin, one of the things that we said is you want people who have expertise in melanin-rich skin because our skin is so sensitive. So I'm thrilled for us to be able to have Dr. Simpson come and join us and to be able to answer our questions. So welcome, Joanne. Welcome and welcome.
Thank you, Anne. Yeah, thank you so much for having me. I appreciate it.
Absolutely.
And I love the brand, and I'm so glad to be able to support other entrepreneurs and good skincare, good clean skincare.
I appreciate that. Actually really means a lot coming from you. So let's start at the beginning. Tell us a little bit about when you were back in school. And what many people don't realize is that when you're actually in medical schools, when you have to decide what your specialty is. So some people go in always knowing what they wanted to do, while others kind of find a way while they're going through their training. So what was your path towards dermatology?
Yeah, my path was indirect. So I actually thought I wanted to be a pediatrician, love kids, but got to the stage in my training and rotation and realized I don't really like that by itself. I don't mind seeing kids, but kids alone, not so great. And I had a really good summer internship at through the American Academy of Dermatology, and it was for minorities medical students to have an opportunity to have exposure to dermatology, with the goal of increasing interest in dermatology and then having more dermatologists of color. So I did that summer internship. I'm originally from New York, and I did it at Albert Einstein, and had a wonderful set of mentors there who just were excellent teachers, and went back to medical school after that summer, just realizing that's what I want to do. It's a competitive specialty, but I came back kind of determined that I was going to do what it took to be a part of it. And what I love about it is that it encompasses so many subjects that I enjoy. I enjoy doing surgery. I'm great with my hands, and I have an artistic sort of brain. So I get to be creative and crafty with injectables, with making people look great, feel great. I love teaching. So what I really enjoy the most from what I do is teaching people how to take good care of themselves. So that it just felt like dermatology allowed me to do that. And I love that people, for the most part, are well and not ill. And then people are motivated because our skin is the largest body organ on the body. And we are, in general, very self-conscious in terms of how we look. And that motivates people to listen to medical advice and heed counsel, as opposed to, say, family medicine, where I remember thinking about that specialty, and folks were not so compliant with managing blood sugars and blood pressure. But you tell somebody, hey, this is what you need to do to look good, and they're like, okay, I'm on it, doc.
Yes.
So I love the intentionality that comes with being in dermatology.
I like what you said, because what a lot of people don't realize is that in many ways dermatology, so we talk about in the beauty business that glowing skin starts from within, but similarly, when you have illnesses, when you have other conditions, it often manifests in your skin. So you can see infectious disease, you can see chronic disease, you can in fact diagnose diabetes by looking at people's skin. We're seeing now through COVID that in fact many of the dermatologists are recognizing when a patient has COVID. And so really from an intellectual perspective, it's incredibly stimulating specialty, because you might see something here, but it means something, completely different.
Very true. Very, very true.
So, all right. So everybody's joining us today, though, because what they wanted to talk about was dark circles. And as I said, within the Absolute Joy skincare group that we have on Facebook, that was the number one thing. So there's actually a lot to say about dark circles. So let's start at the beginning. And so the first thing is, what are the different causes of dark circles? I'm sure you see in your practice, a lot of people come in saying, I have dark circles. Can you help me with it? And the first thing that you have to do is figure out what's causing the dark circles. So based on your experience, what is it?
Yeah, so when I'm doing a cosmetic consultation in my office, I'm looking at the affected area. We call this area in medicine the infraorbital tear trough. A trough is something that holds water. Here it holds our tears. And so the tear troughs are what we're addressing or concerned about when we talk about dark circles. The tear troughs can be dark for a variety of reasons, and I like to just kind of simplify it down to 3 reasons. One is that the skin color can be dark, so you can have extra melanin in the skin in the infraorbital tear trough. That increased pigmentation or melanin can be deposited there, often because of trauma. I suffer from allergies pretty bad, and I'm often doing this as much as I shouldn't, particularly this time of year when allergies are really bad. That friction, that trauma creates a deposition of melanin, extra pigmentation in the skin. So that's number one in terms of a reason for hyperpigmentation or dark circles. Another reason for dark circles is just the loss of fat in this area. For some people, there's a familial connection with it. I saw somebody online yesterday for a virtual visit, and she was saying, what can I do for these dark circles? I was like, well, I hope you tune in tomorrow for this session, because I'm going to be talking about that. And for her, although I couldn't tell entirely because it was virtual, I think she had a combination of the 2 other issues that can create dark circles, and that is loss of fat. So I think genetically she just doesn't have enough fat in the infraorbital area. And then I think that her skin is just super translucent. So that then allows the bluish veins in the skin to be able to be visualized. And then that creates this darkening or darkish color in that area. So 3 main issues: hyperpigmentation, meaning extra melanin deposited, usually as a result of friction, loss of fat, usually hereditary, or skin just being very thin, paper thin, and it's showing the blue veins. So treatment varies based on the underlying cause. So for folks like myself who struggle with hyperpigmentation due to frictional reasons or allergies, using some sort of fade cream to help lighten the pigmentation is usually the recommendation. And there are a variety of options. They sometimes can be irritating when used in this area because the skin is so sensitive. So you really have to, get good counsel on what to use. product wise. For folks who just don't have enough fat volume in that area, there are fillers. Fillers are synthetic injectables. They're cosmetic products that come in a syringe, and they can be injected into this area. And it sounds scary, but you're injecting a needle right through here, and then you're depositing the filler right in the top of that tear trough to add volume. And that volume, it helps to, it's really a light thing. Your eye is deceived. The more hollow something is, the more it seems like it's dark. So when we're lifting with filler, we're changing the contour of that tear trough, and then eliminating some of the darkening or the deepening or the depth of the trough with the filler.
That's one of the reasons why they say with concealer that actually, rather than putting across the entire eye, is that you put it right into that line, and it actually lifts that line rather than trying to do the whole thing, just for that same reason.
Exactly. Yeah. And it's good that you mentioned concealer, because not everything requires medicine or injectable. And concealers are fantastic, especially for the latter reason, for getting dark circles that can't be corrected. If the skin is thin, that's what you've been given. So your best way to address that is to find some good cover up. And then there are lots of brands that have good cover up, and I have a particular brand that I like, and the tip with, not that I should be giving makeup tips, but the tip I learned was that your concealer color should be a slight shade below your natural skin tone. So you want it to be lighter than your natural skin tone, but not so light that it stands out that you've got the reverse raccoon eyes, because that doesn't look attractive either. So those are the three top reasons for dark circles. I am a prescriber of fade cream, and I do injectables in that area. Not everybody's a good candidate for either option, and so it really does require having a personalized consultation to figure out what's the best option for you.
I love that. And one of the things, so as you know, because you yourself have allergies, a lot of us have allergies. And so not only do you get the dark circles, but there's a very specific pattern of the creasing that you get associated with those allergies. The good news is that actually can be treated with some of the over-the-counter products that are available. And I think particularly for people of color, what a lot of people don't realize is that we are twice as likely to have sensitive skin. We have more issues with allergies, asthma, atopic dermatitis. And so that kind of discoloration that you can get due to inflammation is actually incredibly responsive to antioxidants, to the vitamin C's. And it doesn't have to be anything special, but really those are very good. So that's why those kind of eye creams are good for that condition. They're not good for everything, but they are definitely good if you do have that kind of inflammation. So one of the things that you said that I really loved is the concept of, especially as a dermatologist, and I think frankly this goes for all of medicine, in many ways we don't treat people, we coach people. And most of what they actually do at home and in terms of taking care of themselves. So you talked about treatment, but now let's talk a little bit about prevention. So from a coaching perspective, what is it that you would recommend people think about or do in terms of taking care of the skin around their eyes?
Yeah, I think we need to be kind to the area around our eyes. Like you said, for many of us, it's a sensitive area. I think and I'll speak from my own personal experience because I suffer from really bad chronic dry eye. And it's taken me a while to find the right product, but I'll admit I'm lazy. Like I want something that takes off the makeup. I want something that cleans the area. I want something that does anti-aging. I want it in one fell product, and it doesn't exist. And so I think finding a good cleanser that's gentle to use around the eye is important. There are makeup lines that have a focus on sensitive skin. There are even eye cleansers. I use one that's a foam, and it's green tea extract. But it is prescribed actually by my ophthalmologist because I have such dry eye. And it is also a makeup remover as well. So I did get my Wish product, but that is just the cleansing part and the removing of the makeup. And then we were talking about touching base on fine lines. And there are products that can be used around the eyes that can help kind of the anti-aging associated with lines around the eyes. You have to be careful, and I think Anne, we talked about this offline, but we have to be careful about what products we use around the eyes because, again, the sensitivity. We know that retinoids and retinols can be helpful from an anti-aging perspective, but that skin around the eye is so thin. So what you would use retinol-wise on the lower face is not what you want to use around the eyes. Or if you do, just not
In
with
the
the
eye,
same
yeah.
frequency of use or the same thickness or application amount. You really just want to be gentle. And so I recommend retinols around the eyes, but again, be careful about the concentration, the formulation, the brand, get recommendations because there are a lot of things that say they're eye creams. And I can say that's one of my biggest pet
Yeah.
peeves. I'm like, all right, you have an eye cream, but what's in your eye cream? Because it could just be a nice moisturizer, but you really want to be educated about what's in the product and is the active ingredient really doing what it's supposed to be doing? So for example, if you're using a retinoid, retinoids are great for stimulating
Yeah.
collagen. They're great for exfoliating. So they can help exfoliate dead skin around the eyes. They can help kind of add more volume to some extent and help with the texture and tone. But you wouldn't want to see in your eye cream of choice that one of the first ingredients is not a retinoid, if that's what you're looking to achieve, and that it's maybe petroleum jelly or it's some sort of emollient, because a lot of products, the first ingredient that's listed is probably the ingredient that's in highest concentration and the most active ingredient. And so just think there's just not a lot of truth in marketing. And so you really, I tell people they have to be a detective. There's so many products out there that they say they do something and they sound like they're going to do something and people endorse it. And what I want focus on this call and also my patients to take away is that they can be a sleuth and they can be empowered with the main ingredients that are in a lot of cosmetic products and educated about what they do, so that when they are looking for good products, they're saying, but what's the active ingredient? That's what I'm doing. When people bring in products to my office, they're like, dude, what do you think about this cream? I'm like, let me see the back of it. I don't care about the name brand on the front. I want to see what the ingredients are on the back. And then that's what I like about your line. When I met you, you were so passionate about why you created the line, that you really worked on sourcing the ingredients in your line. You handpicked them. You were mindful about everyone's skin being different and sensitive to different things, and it was important to you to have something that was kind of custom and mindful of the sensitivity.
I really appreciate that. I mean, one of the things when I started to really look into skincare products, to be honest, I got angry because I was just like, they are selling us so much junk and the price has nothing to do with the quality. And I think frankly, it's disgusting and they just don't respect our intelligence. So we have a bunch of questions that are coming in. So people are really all about this injection. So the first question that we have is, are there any risks associated with using the fillers on Black skin, as well as are the injectables permanent?
Good questions. So I don't see any concerns with fillers in dark skin. And the primary reason is where it's going. So a lot of the fillers are going into the dermis. They're not going into the epidermis, which is where the melanocytes or pigment cells are located. So in the dermis, that's where we have a lot of the collagen and hyaluronic acid. That layer of the skin is responsible for the humectance of the skin. It attracts water. It's responsible for plumping. That's where the filler gets deposited. So if I can use my pen here, when I'm injecting, let's say the nasolabial folds, I'm going into the folds and I'm injecting the filler into this area. And I'm going rather deep, but not super deep, but I'm getting below the upper layer of the skin. And then I'm also massaging it into the area. So it's not really having an impact on pigmentation or melanocytes per se. The second part of the question was longevity. Is it permanent or is it not? It depends on what you're having injected. So most of the fillers that are in common use are lasting somewhere between 6 months to 2 years. And the longer lasting a filler, probably the more expensive it is. because you're basically getting 2 years out of it. There are different types of fillers. We in my practice use various fillers, but the most common type is hyaluronic acid. It is a synthetic form of what's naturally residing in the dermis. You can think of hyaluronic acid as a sponge, and its job is just to attract moisture. So we put it in the skin, it's a gel, and then this gel just sucks up volume. And that's what you want. And these folds, either under the eyes or the nasolabial folds, or smile lines, as we get older, our fat pockets, they sag just like the girls do. They head south and they create more folds, and they create more folds
Right.
here too. But it's one of the signs of aging that we really try to slow down, and we can slow it down by adding volume where it's getting lost as we age. So the hyaluronic acids in general last between 6 to 24 months. When you talk with your dermatologist, plastic surgeon about what product you want to use, important things to mention is you want maybe something that's going to last long versus short, depends on what you're doing it for. For example, some people are wanting to do fillers just before someone's wedding, or they're trying not to come in every year, and so they want something that's longer lasting and maybe lasts 2 years. There are folks for whom it's important that there's some sort of antidote or something to reverse the filler, and the hyaluronic acid brands or categories of fillers actually have an antidote. So there's an enzyme that can be injected that dissolves hyaluronic acid. It's called hyaluronidase. And no one's perfect. I'm not the perfect injector. I think I'm good, but there are times when maybe it's too lumpy or it overcorrects, or maybe one side was not even compared to the other, and I need to dissolve it to get the desired result. And I like it because an eraser. There are some filler brands for which there's no antidote and there's no way to make a correction, and you just have to let it dissolve over time. And all of them do dissolve over time. It's just the duration of time varies based on the product.
So you talk a lot about this kind of like, fat in your face. And in France, there's this saying that women of a certain age must choose between their asses and their faces. So you can, be a little bit overweight and have a big ass, but then you have a nice face, or you can have a skinny ass, but you're going to have like a gaunt face. And I actually had a friend who, she was like, Anne, we can like do a little stuff in your cheeks. I'm like, nah, I don't need it. And then she did this to me. So here are my cheeks. And then she said, all you have to do is just lift your cheeks. And then it took away like years off of my face, which I was like, damn. So that's like the benefit of doing some of these fillers. So one of the questions that we have here on Instagram, so someone is asking about the wrinkles that they have. So she says, I don't have the dark circles, but I do have the wrinkles around my eyes. Is there anything that I can do about that?
Yeah. So the layman's term for that is crow's feet. And so they are usually transverse to the eyes. Yes. And you have some, and usually some sort of botulinum toxin, or Botox, as one of the brands is known by, is helpful for that. Botox was the first botulinum toxin on the cosmetic market. And there are others that are on the market. I'll just name drop a few of them: Dysport, Jeuveau, Xeomin. If you've been searching around for options or wanting to know the difference between them, they're all in the botulinum toxin family. They differ in terms of the molecule, their structure, how long they take in terms of onset, and they also differ in terms of whether they need to be refrigerated or not. And then some vary in terms of how long they last. So in general, unlike the fillers, which can last somewhere between 6 months to 24 months, your botulinum toxins are not going to last as long. They typically last on average about 3 months. So you're doing it about 4 times a year if you're wanting to maintain it. The botulinum toxins work by, I like to say that they freeze. I don't like to use the word paralyze, but they freeze the muscles that are responsible for the lines. So if you're looking at the crow's feet area and you smile, there's a muscle anatomically called the orbicularis oris. Basically, it's a big eye muscle, goes around here, and it contracts when you smile. And when you smile, as you age, the lines become more apparent. It's almost like using a piece of elastic around fabric and tightening it. And so what the toxins are doing is loosening up, so to speak, the elastic and relaxing the tightness of the elastics, that when you smile, you don't get the pouching or pursing of the skin around the eyes. Somebody was asking if Botox would be appropriate under the eye. I do use Botox under the eyes. It can be somewhat helpful for some of the crepiness under the eyes. And that's a delicate area as well in terms of expectations, because not all lines are mobile lines. So Botox helps lines that are due to movement. It doesn't help lines that are just at rest. So if you're just looking straight ahead and you see lines, Botox is not going to get rid of that. But if you have or if you have lines under the eyes after you smile, Botox may be helpful there. And it is safe to use. It's really in the hands of the injector to not go too deeply, to know the anatomy, to keep it superficial, and to put enough that's able to correct but not overcorrect or cause any visual issues.
I like one of the things you said earlier, which is about how being a dermatologist also has an artistic component to it, because the people that I've seen who are really good are not trying. So I often say I'm knocking on the door of 60. I'm almost 60 years old. There's no way in hell I should be trying to look like I'm 25 years old. But there's a benefit to, you know, trying to kind of smooth things out a little bit and to like not necessarily show all of my years. And so there's some people who I see that I'm like, I know where you were this weekend, because you can see from across the room that they had their Botox. And then there are others where you're like, you know, people are like, are you rested? Like, what's going on? You're like, oh, nothing. I just, you know, had a good night's sleep.
I get it. Yep, and that's the goal. That's in my practice. I aim to have people look rested and feel good about themselves. They shouldn't walk out the office looking artificial or overcorrected or overplumped. To me, that's not natural. And there was a Vidal Sassoon commercial or slogan back in the day that if you don't look good, I don't look good, or something like that. And that slogan is so applicable. Like, if somebody walks out my office and they don't look good, like, it reflects poorly on me. I'm not going to overcorrect you if you tell me you want 4 syringes in your lips and you want to look like Daffy Duck. I will respectfully say you might need to see somebody else, because I just don't believe that is very natural looking. And everybody's entitled to what they want, but it's just not part of my practice philosophy.
Yeah.
So I love that when people want to look rested, or they want to look like a more youthful, rested version of themselves. The interesting thing is that there are geographic variations on what people want. So you go to LA, people want to look like they have had stuff done. I will say in Northern Virginia, where I am in Alexandria, people don't want other people to know that they're doing stuff. I have people come to me and say, am I too young to be doing this? I'm like, girl, the person you referred, they have 2 and 3 other people who are already doing this. And they've been doing it for 5 years without violating HIPAA, but just letting them know, like, there are more people doing it than people realize. And it's because so many people are discreet about it in this area that I just don't think people are aware that more folks are getting it done than they realize. And say in the DC area, I see that there's a tendency to have a little bit more plumping, filling, more exaggerated filler than what I see in Northern Virginia. So even within the DMV, there's the regional differences. That's interesting.
Yeah, well, we're New Yorkers. We keep it real, but we don't tell anybody.
We do.
Not secret. So what about the men though? Because there's like, we don't all want to look like I was going to say name, but that's not being nice. So we don't want to look like some people, but there's a lot of men also who are getting these different procedures as well. So it's not just women who are looking for this.
Absolutely, yeah. And I think the men get neglected when we talk about cosmetics. I'm so glad you're bringing it up. The things that men I see are getting are Botox. So getting Botox, but it's, Roman getting Botox and in this area and in this area. Yeah, and those are the areas where people tend to look angry. I find that guys want to keep their lines around the eyes, whereas we women are bothered by those crow's feet, which is interesting. Men are very bothered by their love handles, back fat. And we ladies are bothered by our pooch, our muffin tops. So body contouring is interesting in terms of what men like versus what women want and like. So there are gender differences, and basically anything that we're talking about for women is applicable to men. but the desires are
Mhm.
different. You know, what bothers us as women doesn't bother men as much, and what bothers men wouldn't be of concern to us. Like, nobody's seeing my flank. I could just wear a looser top and no one sees the back fat. But they might see the double
Right.
chin, or they might see, you know, boob sagging, or they might see the crow's feet or the lines here. So it's just their gender differences. There's nothing wrong with it, but a lot of the same tools can be used, but in
So a
different
couple of
ways.
questions are coming in. So someone's asking, how old are the men on average getting things done? And this person saying in particular that her son, who is 20, is very conscientious about his face. And so I think that she's now asking, like, when is he going to the next step?
Good questions. And I get this question a lot. There's no age, there's no right age to start cosmetic procedures or good
Mm-hmm.
skincare. Um, I think there is there's just a difference in generational thoughts on this. So a lot of my older patients are coming in and, um, pardon the expression, but stuff's hit the fan. And they're trying to do stuff that's corrective. And they spend a lot of money on corrective stuff because there's a lot to do. And so I actually like when younger people are asking me these questions, because the mindset of younger people is, hey, what can I do to be proactive? What can I do to think ahead? What can I do to not look like my mom, who's getting all kinds of shots and products and so forth? And so there is some benefit. There's a lot of benefit to starting early. And the earlier you start, the more you can hold back the hands of
Yeah.
time. For folks who are, and I think good skincare is probably definitely at the foundation of that. You're not too young to to start using a good skincare line. Actually, one of my classmates from residency at the University of Pittsburgh is coming out with a skincare line for young girls.
Wow.
And she was doing a poll of what her slogan should be. And one of the slogans that I thought was appealing was like, it's never too early to start good skincare. So something like that, that's probably going to roll out in the next couple of years. But I just thought it was really smart because it really does start when
Mm-hmm.
you're young. With regard to things like injectables, I think when you start seeing the early signs of some lines, then it's time to have a conversation. So I started seeing some lines last year, and I was like, time to have a conversation with one of my colleagues. And so,
Like, come and help me.
um,
So
yes, and she was like, well, let's have a conversation about my line. So
that's like
we have
hairdressers
help
doing
each
each
other
other's
out.
hair. So we have a
Yeah,
question on
exactly.
Instagram from Crown Heights. So hi, Brooklyn. Happy to see you here.
Hey, Brooklyn.
Saying, hi, I love the conversation. I naturally don't have a full face. Noticing as I age, it is the under eye area that is getting hollow, darker. I've been researching, don't want Botox. What do you recommend?
Yeah, it's going back to that conversation about filler. You know, getting hollow means loss of fat. Fat goes south as we age. So we have fat pads here, they go south, that leaves us hollow. And so that's where filler comes in. So it's again, diagnosing what the underlying issue is. Underlying issue is fat's going south. We got to put fat back
Yeah.
up where it's missing. And it can be fat or it can be filler. And I'll mention before, because you mentioned a phrase that's commonly used in
Mm-hmm.
France, like you choose your cheeks or you choose
Well,
your
you
butt.
said it nicer than I
Um,
did.
I'm thinking about my plastic surgery colleagues. They would say you don't have to choose either, because you can take fat from your butt and put it in your cheeks, and you can liposuction anything. So they think anything's possible. So if you had a plastic surgeon on the call, they might chime in with a third option, in addition to filler, thinking of using something
So that
natural like
actually
that.
gets me to my next question, because actually next week we are going to have a plastic surgeon. And
Okay.
so as we're talking about these issues, what is the kind of divide between what one can do at home versus when one needs to see a dermatologist versus when one should go see someone from plastics? And let's just keep that conversation just within the context of the circles and bags underneath the eyes.
Great. Yeah, because it does get
Mm-hmm.
complicated. Um, it really depends on the laxity of the skin around the eye. So there's some patients of mine, I can grab the skin under the eye and it feels like I'm pulling like gum out of my mouth. Like it's just very elasticy. It is stretching. That means that
It's
skin,
time.
sorry for the visual,
It's
but
time.
it means that there's a lot of laxity. And when there's laxity like that, there's extra skin and the skin has to be cut. So it's a surgical correction that's needed. what's called a
Mm-hmm.
blepharoplasty. So you're cutting the extra skin out. What that entails is making an incision under the lower eyelash, pulling the extra skin up and away, and then cutting the extra skin out. A lot of people who come to my office are really looking for non-invasive options to consider first before having to think about plastic surgery. And of course, that it's cheaper and there's no
Mm-hmm.
downtime. There's very little downtime. So it makes sense that that would be what people would prefer to have. Um, Sadly, I think there are lots of people who are using cosmetic products that are labeled to get rid of lines, and they've been using it for years, and too much time has elapsed using products before coming to see a dermatologist or a plastic
Mm-hmm.
surgeon about non-invasive option or invasive option. So to reframe the conversation, there's skincare, there's non-invasive injectable procedures, and then there's the invasive surgery procedures. I think the laxity of the skin is the big determination between whether we're dealing with surgery or not.
Mm-hmm.
I think the difference between whether it's time for non-invasive procedures versus invasive or non-cosmetic products versus non-invasive procedures depends on like what you're trying to address. So if it's like fine lines, products can certainly help with that. Again, we were talking about um, our retinoids and our hydrators. But if we're dealing with things that are deeper in the skin, loss of fat, we're talking non-injectables or putting something in there to restore what's
Yeah.
gone. So I like to think of this as where is the underlying problem? And I often talk about skin as a three-layered cake with icing. So our epidermis is the icing. And I often talk about this in the context of melanoma because I want people to know kind of where things change or how the prognosis changes based on where
Mm-hmm.
things are in the three-layered cake. But it's a very applicable analogy in this situation because basically if your issue is just in the icing, just in the skin, so if we're dealing with
Mm-hmm.
pigmentation or wrinkles, we're probably going to be able to some degree, help it with a topical product. Now, if your problem's deeper, if we're getting into the first layer of the cake, then we've got maybe some fat loss issues and we can put something into that layer of the cake to plump it up. But if we've got other structural issues, that's when surgery is needed, or the cake's sloppy and it's falling apart and you got to get surgery in there and fix the cake. So that may not be a good analogy for everybody, but I like to kind of think about the depth of the skin in that way, and then strategically kind of strategizing the approach to skincare based on where the problem is
That's a
residing.
great way to think about it. So one of the questions that came in is, what can we do about the lid hoods and the droops that we get above our eyes? So, like even for myself, as I noticed one day, I was like, why can't I see my makeup? And it happens.
It does. It's gravity. We can't change it as much as we wish that we could. There are retinoids that can help to tighten a little bit, but it can't fight gravity. So I've got the same family sort of issue where as we
Mm-hmm.
age, we get a lot of hooding.
Mm-hmm.
And so I know surgery's in my future. And I certainly don't want to wait to the point where I can't see out the corner of my eye to get something
Yeah.
addressed. But the eye makeup test is probably the first sign to folks like, hey, I can't see my eyeshadow, or by the end of the day, it looks smudged. It's usually a sign that there's just increased, eyelid
Or the
hooding
more
that
that your mascara gets
needs
up
some
here, you're
surgical
like,
correction.
how did that happen? How did that? So,
Yeah,
so one of the
yeah,
other
yeah,
questions
yeah.
is, what is the recovery period for under eye injectables?
It really varies, but the window is probably somewhere between 3 to 7 days. And the injectable transition is that you may have a lot of
Mm-hmm.
bruising, particularly within the first 48 hours. That area is very
Mm-hmm. Mm-hmm.
vascular. Um, Sometimes blood vessels get injured in the process of injection, and it can take some time for the bruising to heal. So I tell folks to come with big glasses, big hat, maybe plan to do a procedure on a Friday so they have the weekend to recover. You can have swelling. Again, we're putting in something that's probably hyaluronic acid based. Its job is to attract water to add more volume. So that in and of itself is a foreign body that's going to attract water. So there's going to be some
Yeah.
puffiness until things equilibrium, reach an equilibrium. And then there may be some overcorrection, and again, with the right product, it can be dissolved, or it might just be right and might be slightly lumpy, and you can sometimes just massage it. It's like go into the skin, and sometimes just smoothing it out with some firm pressure.
What's really nice though is that anything basically, from the clavicles up heals so beautifully because we have an excellent blood supply. So people may notice that even if you get a small cut, there's like a lot of blood gushing out. And that's just because we have an abundance of blood that goes essentially to the brain, but the face gets to benefit from that. And so the face heals beautifully. All right, so let's talk about prevention. So you talked about, and one of the questions that we have here is what are some of the things you should do for every decade, say 30, 40, and 50? And so you and I talked about this. If there was only one skincare product that you would use, what would that be?
Oh, just one. The right answer is sunscreen, but my truthful answer is I get something with a retinoid.
And then I will get a hat.
And a hat, yes, and yeah. But honestly, like the cheapest thing you can do is just make sure you're protecting yourself from sun damage. We know the UV rays are what break down collagen, and it contributes to aging. So you have an anti-aging workhorse in sunscreen. We had a conversation about sunscreens and darker skin, and it's sometimes very challenging to find sunscreens that don't make us look purple or ashy, that rub in smoothly, that make us look greasy. And there are a few brands out there that I think do a great job on darker skin tones, but sometimes it's few and far between and you've got to try a lot, and it's hard, right? You can't try it. Not everybody gets a sample of something to try at home, and so it can be an expensive venture. We have a couple brands that we chatted about offline.
Let's talk about the holy grails. So I'm in search of a really good sunscreen, and I'm fair skinned, and even with my fair skin, that white cast is just. One day I tried one of these products, I won't say which one, and I walked into the kitchen and my husband was like, "What the hell happened to you?" Because he said like I look dead. So I'm in the search, and so this is my search for all of the sunscreens. So I have all of this. I have high end, low end, all of this. And there's a difference. So this one is actually a chemical based sunscreen, and we can talk a little bit about that. This one is a mineral based, so it actually physically blocks. And then this one I like because it's a combination. However, it has denatured alcohol in it, so it made me break out. There's different types of chemical sunscreens that have avobenzone as well as oxybenzone, and the oxybenzone is the one that actually from a clean beauty perspective is a little bit problematic. And then there are others that are also a combination of the two. And so what I'm finding is that the high end, the low end, it doesn't matter. And it gets back to what you were saying. You have to read your labels. You must read your labels. Exactly. So at the top of the list is you want to look for products that say that they are broad spectrum. So you'll see it here. So this will say that it's broad spectrum. So this was one of the brands that you had talked about when we were getting ready to discuss. So do you want to talk about this?
What we didn't talk about was, as I'm looking at your sunscreen, I do love that brand. And I also wanted to just talk about SPF because I think there's just a lot of confusion around that. So not only do you have to be smart about the ingredients, and again, being a sleuth or being a detective, not just saying my friend uses La Roche-Posay, so I'm going to use that, but saying, hey, what is recommended in terms of the degree of protection, and then what are the ingredients in a product that are most helpful or most concerning. So SPF just refers to the sun protective factor, how much the product is protecting the skin, particularly over the course of an hour or two. And sunscreens need to be reapplied. So I just wanted to kind of sidebar and talk about the importance of that. The American Academy of Dermatology supports using a sunscreen that has an SPF of 30 at a minimum, and then reapplying every hour and a half to 2 hours. With regard to products and ingredients, you're right, we want to look for broad spectrum. When we look at the sun and what comprises our sun rays, it's UVA, UVB, and UVC. our UVA rays, as I remembered it in residency, UVA is responsible for aging.
Right. That's how I
It's the
remembered.
ray that goes deeper. It's responsible for sun damage and causes wrinkles. UVB is just more superficial, so it's working or impacting the icing of the cake when we talk about that 3-layered cake of the skin. And so a sunburn happens at that level. So we want to make sure that we're getting something that's protective against UVA, prevention of anti-aging, UVB, prevention of burns. And UVC is another, it's a smaller component of that, but UVA and UVB are usually going to be what's covered for broad spectrum
Absolutely.
products. And then you mentioned physical blockers and non-physical blockers. So your physical blockers usually are like titanium dioxide and zinc
Mhm.
oxide. They tend to have a white, I think of your typical lifeguard who's putting it on their nose. Yeah, and it has that white out look, and it's got that cast that we were talking about.
Yeah.
Some brands do a better job, like you mentioned, yeah, of mixing it with other non-physical blockers, basically things that don't have that white cast or hue, so that it's more cosmetically elegant, meaning it looks good and it feels good when it goes on. But you just have to pay attention to the products, and I think feeling them is just really important because not everything looks the same on
Yeah, and the
everybody.
big challenge is a lot of people, as we mentioned earlier, a lot of folks, Black folks, have sensitivity. So, in fact, have allergies to some of these ingredients. And so, so the avobenzone is the one that really doesn't seem to cause that many problems, but the oxybenzone seems to cause many more reactions, and it's one of the ingredients that's actually banned in terms of protecting the coral reef. So
Yes,
I
that's
think the
very true.
holy grail on sunscreen still is out there, which is why I didn't go out shopping. This is all that I had just in my cabinet because I'm still trying to find the right products. And one of the reasons why when I initially started Absolute Joy, I wanted it to be made in Europe is because the sunscreens that they have over there are so much better than what we have available here in the United States. The
Yeah,
challenge is if I have a product that's manufactured over there, I need to do the clinical studies in order to demonstrate the SPF in order to be able to claim it as an SPF. So I can have a lotion, even if it has SPF in it, but I can't claim the SPF because they don't accept certain
yeah.
ingredients. So this issue around SPF in the United States is actually a big problem. And I know some people who go to Europe and then they just basically stock up on all of the products that are over there and bring it back over
That's
here. So
true.
this
Yeah.
is,
Yeah, there's a huge delay in what products, even when we look at our dermatology journals, we're reading about stuff that's available in Europe but not available here. And I'm not sure I know what the backlog is. It's
yeah.
FDA approval, but I mean, it's to the point that there's so much of a backlog that it keeps good products from getting
And
to
what
market
drives me
soon.
crazy about that is, on the other hand, because we're a clean beauty brand, we paid attention to the ingredients. So over in Europe, there are 1,300 ingredients that are not permitted for use, while here in the United States, there's only 11. So they're willing to let through some toxic ingredients that really make
That's
many of
right.
the
Yeah.
products not clean beauty, but they're not willing to let through the SPF. So
Yeah.
I don't know what the issue is, but we're doing our best to try to address
Right.
it. So one of the questions that came in, which actually gets to something that you and I were talking about, the question is, what are your thoughts about over-the-counter products like Ambi, which my aunt swore by as I was growing up? And is it necessary to follow up with sunscreen? So what a lot of people don't know is that many of the products that particularly like our mothers and our grandmothers actually had hydroquinone in it. And so one of the brand standards for Absolute Joy is that we do not include hydroquinone in any of our products. It is an ingredient which is actually banned for use in Europe. And so it makes it easy for us to adhere. Someone's talking about porcelana as another product that is marketed particularly in the Latino community, which has hydroquinone in it. And so for us as a brand, we don't include it because ours is a product to be used every day and to be used at home. And our brand standard is that we don't have it. However, I think there is a role for it in the hands of a professional. So Joanne and I talked a little bit about that. So do you want to talk a little bit about your views of hydroquinone? Because as a healthcare professional, you're obviously
Yeah.
working with it.
Yeah. It's kind of like the wine when we started off, like all things in
Right.
moderation. So I am not opposed to it. I do use it personally, but I use it to achieve a goal, and I use it for a short period of time. I'm typically not recommending it for chronic or long-term use. When I recommend it or prescribe it, I'm asking folks to use it for a minimum of 3 months at a time. There is concern about carcinogenicity. There's concern about something called exogenous ochronosis, which is kind of this paradoxical or kind of weird darkening of the skin that you can get the higher the concentration of the hydroquinone. For some of us who come from outside the US and are familiar with products by different names, sometimes the percentage of hydroquinone that's in those products can be higher than what's even available by prescription here in the US. And that is not regulated well sometimes overseas and can lead to problems, especially if it's used long term. So I think there's a role for it. I do prescribe it and do recommend it. I do sell it in my office, but I'm very clear about how I want folks to use it so that they don't have any untoward effects.
Yeah, so we're completely aligned. So the reason why we don't have it in any of our products is because our products are meant to be used every day, all day, every day, over time, and there's literally no role for hydroquinone within that environment. So I don't want to talk about Ambi or other products of porcelana, but I guess we are. And many of those products actually include hydroquinone, which was meant to be a skin bleach. And as you said, this is actually a huge problem in Africa and in Asia, where people are bleaching their skin, and it's actually causing profound skin damage for a lot of folks. So I agree with you. I think that there's a role in the hands of a professional. So whether you're working with an esthetician or a dermatologist, and if really for a finite period of time, and I think most of the medical literature really talks about 3 months of use and then that's it. So again, in the hands of a professional, when you're trying to achieve a specific goal, absolutely yes. But for everyday use and for some of these products, particularly the products that are marketed to women of color, there's really no role for hydroquinone. And some of you may have heard as I talk about clean beauty, the fact is that 75% of products that are marketed to us are classified as having toxic ingredients. And at the top of that list is hydroquinone, is one of the really dangerous ingredients that if we use it too much or at high concentrations or for too long of a period of time, it really can be problematic. So, all right. So the last few minutes that we have, and I know that we're about to actually die here on Instagram Live. And so for folks who are watching us on Instagram Live, if we die, then we'll just come back in. For folks here on Zoom, you'll just have to watch us get back in. But in general, what are your recommendations on anti-aging? And actually, we had someone a couple of weeks ago who said, we're not using that term anymore. We're actually going to talk about pro-aging, which is the fact that, as I said, I'm almost 60 years old. I shouldn't try to look 20, but I can look like a really good 60-year-old. So when you talk about some of the recommendations for how we can take care of our skin, what would be some of your recommendations?
Yeah, I think we want to look at texture and tone. And so I don't know if many people know the difference between that. So our texture is, how does your skin feel? Does it feel bumpy? Does it look bumpy? And there are agents like the retinoids we talked about that can help smoothen the skin. It's responsible for exfoliation, so it's helping the texture. And then the tone refers to the color. So as we age, we tend to our skin looks dry and it just looks leathery and it looks dull. And so I think products that brighten are great. So I would focus on texture and tone. I think that products that are helpful for that are retinoids and vitamin C. They can be used at any age, whether you're in your 20s or in your 60s or even beyond. But I would say that's kind of the cornerstone. There are lots of other anti-aging things like growth factors and various other vitamins, but those two are probably the best two things to include in your armamentarium.
So this is the point where I should mention the Absolute Joy Skin Refining Night Oil, which has both retinol and vitamin C. And we have those two ingredients just for the reasons that you said. It's a total 1-2 punch that's incredible for anti-aging, and frankly can start as young as the teen years, because people have the issues with the acne, and the retinol helps with cellular turnover. It helps with wrinkles. The vitamin C, I've said by the time you hit 15, everyone can benefit from vitamin C. And there's literally no downside to using vitamin C on your skin. It's one of the few antioxidants that, in fact, is absorbed, as well as there's just a slew of medical research which shows that it is, in fact, beneficial. So this is why we're a very antioxidant heavy, vitamin C heavy brand. We put it in as many of our products as possible. And it's a fabulous ingredient. It's a fabulous ingredient. Okay.
We are aligned in that. Yes.
Yeah. All right. So I'm looking here to see if there are any other questions that I have missed. I don't think that I've missed any on, someone's asking here, what is best for the 11s between the eyebrows?
Yeah, it's going to be a toxin. So Botox or Dysport or the other slew of products that are out there. So some sort of botulinum toxin works for that. The reason being is it's an issue. The 11s are caused by an issue that's deeper in the skin. It's muscular in nature. We've got two muscles in here that create, when they contract, those 11s. So those 11s are the lines, vertical lines that are developing there. You inject the toxin into those lines, it relaxes those muscles so that when you squint, the 11s don't develop.
Exactly. And then someone's asking here, what do you think about TNS products?
About
TNS products?
Yeah, so they're helpful for they're good. They help for more of the elasticity of the skin, and I like them. I try to keep it simple. We do sell that in our own online store, and it's a nice additive, not part of the foundation, but if you were trying to add something else to just deal with the elasticity of skin.
And then someone is asking here about using moisturizer and a separate sunscreen, or is it possible to combine the two? Oh,
I think we went off of.
We died on Instagram Live,
yeah,
so I'm just going
on
to
Instagram, but still on Zoom.
Yep, go ahead and answer that question there.
Yeah, but there are great products that combine a good moisturizer and good sun protection, so you can have a 2-in-1 that does a great job. We talked about some sunscreens earlier. La Roche-Posay does a great job of making some sunscreens that also very hydrating. So I like that brand for that reason.
All right, and then we've had two people ask about freckles. So people are saying, well, what they're calling freckles. And they're both saying that I'm getting more freckles as I age. So I know that, go ahead and you can answer that question while I pull you back in.
Yeah, I think the question I would ask is, are they really freckles? So, if they're raised, there are lesions called DPNs. It stands for dermatosis papulosa nigra. And these DPNs, I nickname them Morgan Freeman spots. They are small growths. People tend to get more of them over time. They love the face, they love the neck, they love anywhere on the body, but that's where we're most bothered by them.
I actually have some right here.
And
I don't know if you
they're
guys
not
can see
freckles.
them. I don't know if you can see them there, but
yeah. And I've got some on the side of my face as well. And they have to be burned off. So usually using some in-office cautery is what's helpful for that. They are not sun-induced like true freckles are. They need to be addressed with more physical means than a topical.
Okay, and I am sending you an invitation to join us on Instagram.
Okay.
Hold up. There we go. All right, people are coming back in. I see Ayadola, I see Kenya,
right.
I see others coming back in.
Hi, ladies.
And there you are. Okay.
And back. Good.
All right, so you are back.
Yes.
And it's telling me that it's waiting for you.
You guys have great questions. I love it. I hope this has been informative. I love teaching, so this is a joy to be a part of.
So just very quickly, just repeat your question about the freckles because the people on Instagram.
Yeah, that's when we dropped off of Insta. Yeah, so I was saying to the person who asked about freckles, if I were seeing them in the office, I would just evaluate whether they're truly freckles or not. It is very common for us to get these age growths called DPNs. It stands for dermatosis papulosa nigra. They're small growths. Mhm.
So I'm showing the folks on
They're tiny,
Instagram.
oftentimes. Yeah, neck is the common location for it. The face. If you're familiar with the actor Morgan Freeman, he has lots of them, and they vary in size. Um, I nickname them Morgan Freeman spots, and they're a sign of aging. And so often when people talk about freckles, that's what they're talking about, but it's not truly freckles per se, but it's those spots, and they need to be burned off, usually with cautery. It's an in-office procedure. I just use heat with a fine needle, and the heat destroys those DPNs, those Morgan Freeman spots, and they come off. And I'm careful, particularly in skin of color, to make sure that I'm protecting the melanocytes. Our melanocytes are like a huge defense for us. They're like, no, don't mess with me.
Right.
And so I've got to make sure I protect the melanocytes by pre-treating the skin. This is where I do use a little hydroquinone to keep the skin from hyperpigmenting before I do any procedures on any skin of color. But it's short-lived. They're using it for 2 weeks before I do the DPN removal, and then 2 weeks afterwards, and then stopping. But it works great because sadly, if someone is not familiar with darker skin and doing procedures, there's a greater risk for hyperpigmentation. And so hydroquinone can fill a role, particularly in that setting of dealing with some of those DPNs or age spots, and
Yeah.
not so much freckles, but yeah.
Your expertise is actually really well appreciated. I mean, I have like little like mosquito bites that then 2 years later you still have them because the melanocytes are just going, very reactive. So another question that we have, so the actual question is, what about calcium deposits under the eyes? And what I'm going to reframe that, and I'm going to actually reframe it as white deposits rather than calcium deposits, because sometimes people get these over time, and there's a long
So they're not.
differential.
Yes, there is. Thank you. That's what the look is. I'm like, what is somebody trying to refer to? The entity or diagnosis that comes to mind is something called milia, or milium is plural. Basically, they're whiteheads. They are, it's not calcium, it's actually deposits of dead skin cells. So the underlying reason for them is that the pores get blocked. There are dead skin cells that normally shed, whether you knew this or not. The skin cells from our surface of the skin is what creates dust around the house. When I found that out, I was grossed out, but that's where dust comes from. It's our skin shedding. But in our individual pores, sometimes there's a little blockage. The dead skin cells get trapped. They don't have anywhere to go. And they just keep multiplying within that blockage. It's like having a 2-liter bottle of soda and there's a cap on. And so there's more pressure developed inside, and it creates these little balls of dead skin cells. The ball of dead skin cells looks like calcium, but it's not. It's actually just keratin, which is the layer of skin, top layer of the skin, and they can be extracted. So that's how you deal with them. So if someone were coming into my office with milia, I would literally take a tip of a blade, create an opening in the surface, basically screwing off the cap from the bottle, and then taking out the keratin.
And also retinol is very good for it. So I found for my eyes, I actually used to have a couple of these in here, and then with my oil. And again, you don't want to put this on your eye, but to work it up to the eye, because it has retinol in it. It takes a while, but I found that the milia worked their way to the surface, and they disappeared.
Yeah.
Yeah.
And that's the key thing, the difference between whether you manually extract it or use a retinol. It's like, how patient are you?
Yeah, because it does take a while.
And so those of us who are looking for instant gratification, we're probably going to end up having it manually extracted. And then retinol, a great long-term product to use, so that as you potentially could develop more over time, that you're having something that you're using.
So for people, if anybody has these issues, that what I would encourage you to do is actually go see a doctor. And again, Dr. Simpson has these virtual visits, because what some people, it could be keratin, as Dr. Simpson was saying, it could be calcium, it actually could be cholesterol deposits. And so it goes back to what we were saying earlier, that in many ways your skin can be a puzzle or a clue to things that are going on inside your body. And so it really is beneficial to have a professional take a look, because they can tell you a lot about what's going on. All right, so we are actually over time, and I think that we are done with all of the questions that are going on. So
Good.
this was so helpful. And as I said, there was a list of about like 15 issues that people wanted to talk about
Good.
in the Absolute Joy Skincare group on Facebook. And so I invite you to come back, as we're going to have like, more issues, whether we're talking about skin tags or anti-aging or whatever. But this was incredibly informative. And so I don't know if you can see that we're getting a lot of
Oh, I
applauses.
can't see, but thank you. Good. I have enjoyed it. It's
And
been my
people
pleasure, and
were
I'd love
getting
to
a
come
bunch of
back and
thumbs up.
teach more.
So for those of you
Good.
who are new to Absolute Joy, I invite you to come and join us on Facebook at the Absolute Joy Skincare Group. Also, you can follow us obviously on Instagram as well as on our Facebook group. You can also come and just check us out on our webpage, which is absolutejoy.com, and sign up to receive notices. Joanne, Dr. Simpson, I thank you so much for your time and energy.
Sure. And
incredibly informative.
I'll be happy to see anybody at my office. And I'm in Alexandria Associates in Dermatology. If you're looking for a virtual visit or in-person visit, send an email to info@alexderm.net. Or Google alexandriaderm.com.
Exactly.
And be happy to help you with your skincare needs.
And what I'll do for folks who are interested in following up to reach out to Dr. Simpson's office, I will actually post that on within my group on the in my Facebook group. And again, the Facebook group is Absolute Joy Skincare Facebook group, and we will post this as a follow-up. And so I thank everybody for coming. And as I mentioned, next week, we're going to have a plastic surgeon who will talk to us about this continuum of a number of issues that we're talking about. So with that, have a great week and stay safe, stay well, and I'll see you all next week. All right. Bye-bye.
Bye. Thank you all.
Thank you.
Thank you.
Thank you for letting me be a part of this.
Absolutely. I'll call you in a minute.
Yeah. Okay.